In this video, I'm going to talk to you about a very vital ingredient that's necessary for all therapeutic interactions, and not least voice therapy, and that is trust. One of the things that makes a therapeutic interaction successful is trust between the client and the therapist. Now, it doesn't always happen instantly, because mostly when clients come, they have lots of doubts, lots of fears, lots of anxieties about their voice or what they're going through. So it's very difficult in the beginning to trust the therapist or the process. And sometimes you might start the process and not develop the trust. And that's why sometimes people do change therapists or go to different services. In a therapeutic interaction, one of the things the therapist will be striving to do is work on building trust with an individual. Trust is vital for developing confidence in the long run, because some of the stuff that the therapist will be asking you to do will be exposing when you're trying exercises out and talking about things that are perhaps difficult. So maybe trust won't be instant, but as the process develops, usually it builds sufficiently that the therapy continues and the person feels okay enough to try the exercises, perhaps talk about the things that influence the voice problem in the first place or how it's making them feel now. All of these things go into the therapeutic process. Sometimes having a voice issue or a voice loss affects you socially, affects you at work. That brings another layer of anxiety perhaps on the issue. So these things being talked about and the therapist helping you find some kind of problem solving around that or ways of managing it, are all relying on an effective trust relationship between the therapist and the voice client. So although trust isn't often talked about openly when in relation to speech therapy and voice therapy, in fact, it's a very key ingredient. It helps you discuss emotions, it helps you try exercises, as I said, and it helps build the rapport that means that you're confident to carry on in therapy. You might try therapy and after a couple of sessions think this isn't for you, or this person's not listening to me, or I don't feel that this person's understood. But with a bit of support, and it's always a two-way listening thing, voice therapy, usually that trust will grow to a level where the harder exercises can be done or the deeper topics can be talked about. And in that sense, and with that kind of support, your voice issue will be addressed effectively. Now, I'm usually in a position of saying to somebody, I think your voice can get better, or don't worry, something can be done about this, and people just don't believe me. And being able to stand not being believed, especially in the first session or two, is a big part of being a voice therapist, or at least being an effective voice therapist. Because if I was to believe what the person was saying to me, that they didn't think anything was possible and they didn't trust anything was possible, I would just give up. But I don't. I listen to that and I understand how they're feeling, because of course they don't know what's possible. But when you've been working with people's voices for many years, you'd start to get an idea of, I know how to take this person through, or I think I'm going to try this with this person and we'll see how we go. And I just say, just stick with it and see what happens. That's really all we can do in life when we're not sure about something, is just try it. That you think the therapist is saying this, okay, let me try and see what they're saying and I'll have a go. And then when some things start to change, sometimes it takes a little while, sometimes it's much quicker than you thought, and sometimes it's much easier than you think. But when things start to change a little bit, you think, okay, I'll do the next step and the next step. And then that's usually when the trust is quite well established. Actually, a really nice moment for me when people who didn't have any belief and didn't think anything was possible actually then will say to me, gosh, I did it and I didn't think I could do it. I had no belief that I could do it. It's true that often we doubt ourselves, and they often expect that they will know the outcome. And of course, if you haven't been through that process before, how can you know the outcome? So we do sometimes have to abandon, throw caution to the wind a little bit, maybe go to the expert and give it a go and see what happens, rather than worrying about what will happen or thinking that it's not possible. Very often, it's really possible. I know it's a big ask to get people to go along with the voice therapy process and to trust that it's going to work for them, or at least that the process is going to do its best for them to get their voice to where they need it to be, or better enough that it works well. Whatever the issue is, it's a big ask. But because I know that the outcomes are often beneficial for people, I ask that they go along with the process and trust a little bit to see what's possible. It can be scary to have something that doesn't work very well, to have lost a voice, to have not be able to sing like you used to, want to sound different because your voice doesn't match your gender identity. It's a big ask, and it's actually quite a big step to take sometimes to see somebody about your voice. So you can relieve some of that burden you're feeling by interacting with the therapist and coming to seek help. And then it's always working together. It's a joint process, and it's right that you're supported through that process. If you found the video helpful, click the like button and subscribe to the channel.